All right, good afternoon, everyone.
Okay.
Thank you guys for taking time out of your Saturday to join us. We know that you are busy dealing with COVID and a busy day of work, and others of you are enjoying the Easter and Passover holidays. This WebEx was a request from the Northwest Task Force, and it highlights what is working well or some outside of the box ideas for dealing with COVID-19. Your colleagues have kindly agreed to share these ideas with you in the hopes that it helps your planning efforts or your response efforts.
We lost your audio.
All right, sorry about that technical difficulty. Our agenda today, we have a few speakers that have agreed to talk with you, including Chester County, Northeast, Blair County, Bradford County, Bud Mertz from Westmoreland, and Allegheny County. Few rules and housekeeping items for today. All callers are muted. No questions will be taken today. If you guys as participants have questions about something that you're hearing your presenting colleagues talk about, please reach out directly to that county or task force that presented for more information. We wanted to thank you guys for all of your efforts over the last couple weeks. Slides will be sent after the call so that you have contact information, and the recording will be sent out later today. Our first speaker is Bill Turner from Chester County, and his contact information is on the screen. Bill, go ahead.
Hey, good afternoon. Can you hear me okay, Kelly?
We got you, Bill.
Go ahead, Bill.
You got me? You can hear me okay?
Yes.
Can you hear me okay now?
Yes.
All right, I'll get started. Good afternoon, everyone. This is Bill Turner from Chester County Department of Emergency Services. Thanks for getting on the call today. I do not have any slides. Just want to highlight some of our lessons learned through this already, even though we're still in the middle of it, as well as best practices. I'd be glad to share answer any questions you have at the end through email, or anything I mentioned through email if you just want to reach out to me at the end. So with that said, we've been activated to a level 2 since March 12th. Really just day shift only. It's obviously not a typical activation. We're very fortunate to have our own health department who has their own health operations center. They've been activated really since the first case was identified in the U.S. back in January. So they've been doing a lot before we pulled into the operation into March. So I really just want to thank them for all that they've been doing and continue to do. And I say it's not a typical activation because, normally we focus on, as everybody knows, road closures and power outages and things like that, maybe a couple operational periods. But now we're getting into our first month of this and really no end in sight. So For us, it's been really heavy on things that we typically don't spend time on, to include resource management and logistics, and that's really what I want to focus on today. Normally we only have one person filling that role in the resource support section, and now we have up to 12 to 14 on most days, just the volume of requests and things that we're bringing in and pushing out the door. With our county being large as it is, we've split our operations between our primary EOC and our alternate. So we're working through challenges with a split EOC operation. Very early on, we realized that each operation, each site should really focus on one thing. So our training campus took the resource management and logistics piece, and our main EOC took the planning, the health, and the human services pieces. So that seems to be working out now that we sorted that out, with our campus really being that receiving and distribution node for the resource management and logistics. So some of the best practices that we've identified really is that, we started barely with any PPE. We do have a small warehouse, but a lot of what we had was expired. So we initially, very early on, got very large requests up to the state. Soon realizing that what was going to come from the SNS was very limited in quantity, and that, we couldn't rely on that as a source to get through this. So we really had to get creative, understanding that, sometimes you can call other states or other parts of the country to come in and help you out, but with everybody impacted, that's not the case with this. So we realized we really needed to find creative ways to find PPE and other resources. We followed our normal process, making the requests come up through the EMCs for both healthcare and municipalities to the county, and things were working pretty well. But what we did have in limited quantities was getting dwindled down pretty quick. So we very quickly started to identify ways that we can procure things. The challenge there is that the supply chain was very damaged, obviously. So, early on in this, we were getting a lot of emails from businesses and vendors locally and throughout the country that had stuff or were changing their operations. And at the time, we didn't really put a lot of thought into it, but we soon realized that we needed to leverage them. So we dedicated a position just tracking all those offers of people reaching out. So one thing I can say is if somebody's offering you something, definitely file it. We just have a giant spreadsheet running of everybody that said, hey, we can offer you a hotel room at this rate, or hey, we can do this for you. And it's paid dividends. Some examples are Strasburg Railroad. With some of our mass fatality planning, we needed to get a rack system built for a container we bought. There's a lot of companies out there that'll charge you a lot of money. Strasburg Railroad said, hey, we can do metal work, and did it for a third of the cost. We have some pharmaceutical industry. Very early on, they said, do you want these wipes we use to clean sites? We didn't really need them at the time, and then we started getting a lot of requests for sanitizing wipes, and they donated those wipes by the pallet. So, if I can give any bit of advice, if people are offering to help, at least follow back up with them and say, I appreciate it. We might not need it now, but we'd love to maybe take it up on it later. So that has really been, I know the volume of email and those offers is tremendous. That's why, if anything, just grab a person, put them in a seat, and just track all that and make those phone calls to get you what you need. And it really has worked out well with us. The other side of this was that some of the vendors that did have stuff really wanted us to place large orders for things like N95s and surgical masks. Nobody wants to buy 1 million masks and be stuck with them at the end of this, and sometimes that's the minimum. So it's really important to work with your neighbors, come together and say, well, as a group or as a region, we can make up that large order and do that so that you can get what you need. But at the same time, there's unfortunately a lot of vendors out there that will tell you one thing and not deliver. So it's really important to have someone do the homework on that, ask important questions up front, like types of payment terms, the timelines for delivery, because they may tell you have it, but soon to find out that it's not coming. So, and the tricky part with this is a lot of these vendors want payment up front, and that's not typically how county governments operate, or municipal even. So it's a very challenging environment, but if you really have those questions, and I can share those with with anyone that wants those questions, but anytime a vendor said, hey, we had this, we would send them pretty much a pre-canned response of like, okay, you have to answer all this before we do business with you. And a lot of them wouldn't respond, and we kind of knew that maybe they're not the ones we want to do business with, and the ones that did, we were able to make some of these larger purchases. So that really worked out well with us. And even if we end up with a lot of stuff at the end of this that we can't use, the good thing is a lot of this stuff can be used by healthcare and hospitals. So we're not worrying about that. And I know it's scary to make those large purchases, but in this environment with a limited supply chain, you just have to do that. And it's really important along those lines to have someone in your emergency operations center or with you that can make those decisions, because what we found is that a lot of our staff that aren't essential employees, like those that set up our vendors for the county, while it's important, are working from home. and they're backlogged, and they weren't understanding the importance of how quickly we needed to make these purchases. We would call people and they said, you know, we have it, but you need to get us a PO by noon. And at the time it's 11 o'clock in the morning. So, you know, we all know government doesn't work that fast, but if you want to get stuff in this environment, again, you got to get creative and you got to be able to work fast because you'll lose things, unfortunately. The other thing we identified is that, you know, if you call somebody and they tell you they don't have it anymore or they won't have it for another week, call again in the afternoon. We have a position that is just calling vendors nonstop, day after day, you know, multiple times a day, because what we're finding is they might tell you they don't have it in the morning, but you call in the afternoon and now they have 500,000 masks to purchase. So it's a lot of chasing people down, but it's paid off for us as well in that sense. You know, again, the big thing is as you're spending money, as we all know, we need to track everything. So we, you know, really made it important to get our fiscal staff pulled into the EOC operation, even though we're only at a level 2 early on to track all those expenses. But again, you know, it's important that they're in there, that we have the decision makers that can pull that trigger up for us and get us what we need. I know I went through a lot of what we do very quickly. We're still very much in the thick of it. I don't want to take up too much of the other speakers' time, but you know, a lot of it is not necessarily anything new and innovative. It's just a different approach to what we're used to, and that you need to be aggressive. You need to take what you can get, and you just really need to chase people down because if not, you won't get these supplies in this environment. So if you can do that, I think you'll be successful, and work with your neighbors, work with your hospitals. We got them on a call and said, hey, you know, we can only order this if we order 1 million. If we order 1 million of these, are you going to take some and pay us for them? And that worked out very well. So get your healthcare involved and just keep pushing and see what you can do to get this stuff. With that said, I appreciate your time. If there's anything I can help you with, please let me know. My email is up on the screen there. I'd be glad to help. Take care of yourself, stay healthy and safe, and you know, we'll get through this together. Thank you.
Thank you very much, Bill. I appreciate your time. All right, now we're going to go to Tim Knapp. And let me pull him up. I don't know, did he call in as a? That's me. All right. All right. Tim must have called in as a call-in user, so I have to figure out which user he is. So we're actually going to skip right now to Sarah Neely from Bradford County. Sarah, go ahead. Sarah, you might need to unmute your phone.
Can you hear me now?
Yeah, we can hear you.
Okay, perfect. Okay, so this online technology has been a challenge for all of us, I think, right now. We're not used to it. So like a lot of you guys, our rural counties, you know, we're seeing, we have a lot of seasonal homes and trying to plan for that has been a real challenge. We've wrestled with it for a while now. For about 3 weeks, we're trying to figure out the best way to gauge what the tax on our healthcare system, our stores, you know, we're trying to keep our folks from being exposed as much as possible. So we had originally pulled our EMCs, our local coordinators, to see if they would want to go around and check their seasonal locations in their area. And with the tensions being as high as they are, we obviously don't want people going up to cabins in the middle of the woods. A lot of people around here are gun owners, so we didn't want anybody to risk getting shot at potentially or exposed. We're never going to really know if these folks who have come up here are just trying to stay out of being exposed or if they're up here for self-isolation. So that being said, we were trying to find the best way, and it didn't seem like having our EMCs drive all over the place was going to be the answer. So what we did is we pulled our tax parcels with our GIS folks to get an idea of how many seasonal locations we were actually looking at. And Bradford County has over 6,000 residences that are owned by people who are not Bradford County folks. So that's a lot more than we had anticipated, and we were trying to find the best way that we could figure out how many were now occupied. So what we did was reach out to our local electric companies. We have 3 in our county that serve all of our residents here, and we had them cross-reference our tax parcel IDs. So what we did is we put our information from our GIS folks into an Excel spreadsheet, and we sent it over to all of our electric company agencies. And they were able to identify, due to the uptick in electric use as opposed to normal. Usually if you're a seasonal resident, you don't use a lot of electricity, especially if you're not here. Obviously, you're going to have some stuff that might still be plugged in. So they were able to identify some of our facilities or some of our residents that had an uptick in their normal electric. So that gave us a better picture of how many folks we were actually looking at that came up here, whether it was to self-isolate or to, just try and stay away from whatever virus they were coming from. We have a lot of people here from New Jersey and from New York, and then some folks from downstate as well. So this helped us immensely plan with our local medical system and let them know. We gave them an idea of what kind of uptick in residents moving here or relocating here for the time being, so they could plan on their end. Normally we know how many residents we have in the county, but that doesn't include the folks who are moving up here. So that was how we worked through trying to check out. And if you look at our map that we have up there, there's a lot of parcels that are folks who are not from Bradford County. Not all of them are have people in them right now, luckily. But, I know that a lot of us are struggling with how are we going to keep them out. And my commissioners are like, they own property here, so we can't tell them they can't come up here, but we can plan for them. So that was the best way we figured to plan for them, was to check with our local utility companies. The majority of them don't have local water or anything like that. A lot of them are on wells, if they even have water in their area. So the electric company seemed like the logical option. So if you're trying to work through that process as well, I encourage you to work with your GIS folks if you have them, and then cross-reference them with your electric companies to see who actually is occupying these spaces, so you can properly plan. Not only for your residents, but your grocery stores are going to start seeing an intake in folks coming up here who are going to be stocking up. So that's going to take away from your local folks as well. So that is what we have done. If you guys have any other questions or need any assistance, please reach out. My email is on the first slide, so I assume these are going to be sent out afterwards. But yes, please just get a hold of us, and we're all in this together and struggling through it together. So, all right, Kelly, that's about all I have.
All right, thank you so much, Sarah. I appreciate your time. All right, so now we will go back to Tim Knapp, and let me get him as a call-in. Tim, is that you?
Can you hear me now? Do you have me?
Yeah. You're good, Tim.
Okay, thank you. Good afternoon. My name's Tim Knapp. I'm the chair of the Northeast Terrorism Task Force and also the EMA director here in Pike County, Pennsylvania. Just a little facts of our task force for those who aren't sure. We cover a 10-county area that starts in Lehigh County and goes up through Susquehanna and picks up Luzerne, Northampton, Monroe, and all them in between. Early on in this adventure, we were approached by some folks at Pima to see if we'd consider working together as a task force to try to streamline some of our requests and whatnot. We've always had a great close working relationship in the task force, so I didn't think this would be really an issue. After the first call, we sat down, the 10 of us, and discussed what we wanted to do. We hit the road running pretty much. Few things that we do now as a task force, we put in our PPE request together. We conduct conference calls with the 10 county, everybody on the 10 county, from the coroner to the EMA director to the 911 staff, the HAP, the Coroners Association. Everybody gets on a call Monday, Wednesday, and Friday at 12, and we discuss what's going on for the next 48 hours and what our needs are. A few advantages we've seen over the working together is the fact that we decided to put a receiving station in Lackawanna County and Northampton County, so we're covering north and south. Makes it a little easier on Pima logistics. We haven't used it quite yet the way we want to, but we believe we'll get there. And it does two things. It allows Pima to just have a drop at 2 sites, and it also allows us to say, for example, maybe think numbers are down in Pike County here, and I could tell my co-chair Todd in Northampton, hey, you got bigger problems. Why don't you take some of my stuff and use it up there? So it gives us the ability to share in between. We also have a staff at the task force that manages the task force, and we've been tasking them with numerous jobs. I mean, we have one of our task force staff right now picking up sanitizer in one of the counties, I'm not even sure, I think it's Lehigh, and delivering it elsewhere. So we're able to use those resources real well also. We've expanded on from that because we know everybody's time is very valuable and we don't want to take up too much of it on our 3-day calls. So what we've done is the Coroners Association now have their own call on Thursday, the 10 of them. So then they report back their needs to us, and we meet again on Friday, and we hear their needs, and we're able to push that up through also. It does get frustrating. I'm going to tell you, but working with anybody, it'll get frustrating at times. But we're able to push through, and we have enough of a professional relationship with each other that we're able to get the job done at the end, and we feel that the more resources that are available to us helps everybody involved. I mean, we have counties that have 30,000 people, and we have counties that have 600,000 people, so we're pretty diverse. We have counties that have 60,000 people and now have 120,000 people because of New York and New Jersey. So we are working through that stuff, and we do push through. To be honest, I got to start telling my girlfriend every time Todd calls me, it's the State Farm Jake, because we've talked a lot over the last couple of weeks, and I feel like we're making headway, and we're just trying to help everybody else out. I don't know if everybody's set up to do something like that, but I would encourage it. At least have conversations and see what everybody's doing, your neighbor next to you. And I couldn't think of a better situation to use the task force as a whole as something like this that we've never seen before. That's about all I got, and just running down some of the resource stuff that we've done working together. If anybody has any questions, they could reach out to my email. I'll tell you, everybody the same thing I tell at the end of the calls usually, we're in this together. There's a lot of unknowns. Don't get frustrated. Just keep trying to push forward and help the situation out. Okay, Kelly, I'm done. Thank you.
All right. Thank you so much, Tim. I appreciate your time. I did not see Mark Taylor log in, so we're going to go to Bud Mertz next. Give me 1 second to get him pulled up. All right, Bud, you're unmuted.
Okay, you can hear me?
We're good.
All right, thank you. I was asked to talk a little bit about the dashboard that we developed here in Westmoreland County. And if you can go to the next slide that actually shows it. Is it on? There we go. All right, so this was created, first of all, it came out of a meeting that we had with our EMS directors on the best way that we could monitor the situation as it was growing and have an idea of when the incident is surging, as well as the capabilities of our hospitals. Our IT department developed the dashboard from ArcGIS format. We were able to give each one of our EMS directors in the county an account to that to visualize it. If you look at it on the right-hand side, the first thing it has is the list of counties, and this was taken a couple of days ago, this snapshot, but has a list of counties and the cases that positive cases that came back. On the bottom, we just changed this, but on the bottom it is in the small blue box there, it has the hospital capabilities, the bed space capabilities. Originally, this was a flow through thing that we could look and actually look at the available beds, the available ICU beds, and so on and so forth of the area hospitals. We changed that to a chart now that it was doing it. So our staff would sit there and go through each one of the EMS calls for the day, and they would monitor as far as the number of calls that came in that day and the number of calls that met the criteria for the review to conduct as far as the protocol goes to ask the questions. And from that, the number of cases that came out, yes. So every day, this would be updated in the morning at 8 o'clock in the morning that we would get the number of EMS calls that came into the 911 center, the number of calls that were, we went through the screening process, the protocols. If any of those were yes, we would indicate the number of yes on there. And so on and so forth. So basically, this was a common operating picture that we wanted to develop so that all the information is shared by the EMS directors in the county, and they have an idea of surge and capacity as well going through there. Besides this, we also created several different databases that we would use, and this information was shared on a common Google Drive, I guess, that we gave them accounts to that would actually give a breakdown of the locations of where the screened yes locations were, as well as the nursing home calls that we would have. And again, it's just a matter of sharing information and putting it to the right use. That's about all I have on it right now. And if anybody has any questions, they can email me or go through the process. Thank you.
Thank you so much, Bud. I really appreciate your time. All right, I think we found Mark, so let me unmute him. Mark, can you hear me?
Yes, can you hear me?
Okay, let me get back to your side here. Okay, go ahead.
All right. I was asked to talk about best practices for Blair County. We haven't been greatly impacted yet, so most of what I have to report, I wouldn't consider best practices. It's just our planning and preparedness so far. We haven't seen any challenges. Our cases have been very minimal. We're in the South Central Regional Mountain. So basically, most of it has been planning. Early on, I formed a COVID-19 task force. Formed it with the local emergency management coordinators, hospital executives, nursing home leads, school administrators. We lumped in the police, fire, EMS, 911 agencies, along with public transportation and the county commissioners. We do a meeting every week. Instead of everybody trying to guess what's going on with each of the agencies, we felt it was important for collaboration to get everybody together. So we do a conference call. There's close to 60 people on that call every week. We have each of those agencies do a report out, and it's been real good information sharing, and it helps me from an emergency management standpoint recognize exactly what our unmet needs are. So that's been going very, very well. Any of you, I would recommend that. It seems it takes everybody off their own little island, and it gives that sense that we're all in it together. There's been a lot of good thoughts shared. There's been some change in directions that have been made because of what they've learned on the call. And so far, it's been very, very helpful. We then have weekly meetings with each of those, kind of treated like subcommittees, particularly with the nursing homes and the hospitals. One of the things we did last week is I formed a emergency management healthcare command team. We've been meeting separately. That team is made up with the hospitals, EMS, local emergency management coordinators. We are essentially working on alternate care facility plans, mass testing facilities, hotel for quarantine, and those kind of things. So that committee has been doing very, very well. Again, we call it a command team because of some of the high-level decisions that we're making together. Like everybody else, we are working to get hotels set up for quarantine. We have those arrangements made. We've done an MOU with our Blair County Convention Center that would be used for an alternative care facility. We have the team working on that if we needed to go to a secondary location. We have been sheltering the homeless. We have about 140 homeless in Blair County. We have 35 of those currently moved to hotels, working on getting them meals so that they don't have to leave the premise. We've been working with the coroner's office. We have reefer trailers moved into our Department of Emergency Services for temporary morgues. Concerns, of course, with funeral directors and the amount of potential deaths, trying to stay on top of that. We are now, based on information we got from the Department of Health, doing just-in-time training very soon with our pod facilities. The timing's kind of good for that with the schools being out of session. So the superintendents are working with us to pull that out. I have the state police and local police working on security plans so that we can bring our pods together should we decide or need to do some sort of a mass vaccination session. Can't speak enough to our task force, South Central Regional Mountain Terrorism Task Force. As you heard from one of the other speakers, that's the key to this. We're in it together. We're always meeting, talking about joint purchasing. We're doing a resolution now to be able to do purchasing like we heard from the Chester County gentleman. Keeping everybody in the same conversations and knowing what one another's done, particularly in our rural area. So my hat's off to our chairman and to the rest of the members of the executive board. That's what we're doing. Hopefully we're doing the right planning and preparedness should we see surge. We're still, again, only at 10 cases, so we're not dealing with what a lot of you are. We do know that we have transients from New Jersey, New York, held up in hotels, doing self-quarantine. Police and everybody's keeping a close eye on them so that we don't have any form of community spread through that. That's about all I have for now. Thanks, everybody, and if I can be of any service, please let me know. Thanks.
Thank you so much, Mark. I appreciate your time. Finally, we have Matt Brown from Allegheny County. 1 second till I unmute him. All right, Matt.
Okay, thank you. Good afternoon, everybody. I think for the most part, I know most every one of you, and to some degree, certainly appreciate all the previous presenters. Bud's certainly a great partner, but a lot of my stories are similar to Bill Turner's. Really appreciated Sarah Neely's mention of how they use their electric resource to get some data and information. So I'll just give you a quick Allegheny County view and then touch on maybe some other highlighted things that we're doing that I hadn't heard mentioned from the group. And I certainly, I think for most of you that do know me, I'm not stating any of this to show that Allegheny County is better in any way, shape, or form, but we are different. I think we all admit to that from time to time. So Allegheny County is 130 municipalities, 170 fire departments, about 100 police departments, and 40 EMS agencies. We're pushing about 1.3 million within the county. Pittsburgh is a great partner to us. Region 13 is a great partner. We're the fiduciary for Region 13, and for the most part, the hub or central connection to Region 13, which is 14 counties in the city of Pittsburgh now. So I just use that to kind of give you a comparison. Certainly across the Commonwealth, we're very comparable to Philadelphia, except that Philadelphia is the city and the county. I think from an emergency management standpoint, or anything on emergency services, we're drastically different from Philadelphia. Our complexity is much greater with the amount of agents. So I'll just run down really quickly a little bit of a timeline from when we started our ESF 8 group, health and medical, which was led by actually coordinated by Keith Morris, our EMS coordinator, led by our Allegheny County Health Department, began their efforts in January. Late February, and I actually think it was February 28th, we began making some changes internally as far as canceling meetings, trainings, et cetera. We do a lot for many public safety. We began reviewing our pandemic plan, which we've had. We tweak that for every pandemic that comes about, as well as our concept of operations for our EMS and EOC. March 2nd, roundabout, we converted our EOC, which was at a level 3 initially, quickly ramped to a level 2, but with the help of Steve Emberlina, who's my assistant chief of operations, and certainly one of our most logically savvy people. He won't admit to that. We converted our EOC beginning about March 2nd to a virtual EOC using Microsoft Teams. I will tell you that Teams has been fantastic for us. We've got probably about somewhere in the neighborhood of 60 to 70 people in our EOC every day, 8 to 4. We meet at noon on Saturdays and Sundays. Teams, what we found is that it's a good one-stop shop where we've got everything captured, every document. Steve's recording every one of our meetings. We meet 8:15, noon, and 3:30 every day. But the team group is open on our computers. We can chat there privately, or we can just open up a mic and shout for someone. We can screen share. It's been fantastic, and we've all become minor experts at it. It's a lessons learned moving forward. On the 911 side, we made some drastic changes very early. We've got a very large facility our emergency services works out of, not just 911, but emergency management, our fire marshal's office, as well as our fire training academy. So 70,000 square foot building. We had Bactronics treated almost a month ago. which was a great help for keeping a relatively very well constant decontaminated area. We shifted a lot of our screening opportunities in 911 very early with simple screening questions, worked through our ESF8 health and medical group to develop those. That's grown into many, many other facets, including a connection to our poison center, who further screens on calls that we might label as potentially COVID-19. As we put the units en route, we transfer the caller to the poison control, and they further screen. And then the units can actually contact poison control before they make entry to confirm whether or not they feel there's great need for COVID-19 protection. And again, we certainly put the caution out that everyone needs to act as if everybody's positive, but it has helped to control our burn of PPE. So screening, many, many directives and changes in 911. My 911 center has about 50 people per shift. That's comparative to some of our partner counties. Our challenges are quite different. And some of the other counties with a smaller 911 center, they could segregate them into even separate rooms. I don't have the ability to do that, but luckily in our new facility, the room's big enough. We've been able to spread the desks out much further, the console spaces, also into our regional area and keep good distance. Fire marshals, emergency management, our fire academy, they've all been repurposed as well as doing their regular jobs. For the most part, they always live with an office in their vehicles anyhow, so it was an easy conversion for them. They each do a rotation to the office about once a week. The reality continues too, and I'm sure each of you are hit with this, but all of us, many of us had to deal with storms and flooding and fires recently. For instance, this last storm, not only did we have two tornadoes confirmed by National Weather Service, but Stephen Berlina actually had to help the National Weather Service to go confirm storm damage, to come up with the idea that it was a tornado, because National Weather Service isn't allowed to really go out. So we were happy to partner with them. They're actually in our EOC as well. But for instance, we've had 9 tower sites for our about 47 of our 47 tower sites on generator for about 3 days due to power failures. So it's just a reality check that we still have our regular jobs to do as well. Last Friday triggered another directive change and more resource support, particularly for our government entities, as the news came out that the governor and the secretary of Department of Health mentioned the use of general masks for everybody. Well, that triggered at 2 o'clock on a Friday, having to stand up our county jail as well as some other agencies with necessary PPE, low-level PPE, but necessary. So we were able to do that all in 2 hours. Logistics really ramped up really hard mid-February. We did have a good stockpile of masks and other PPE, but combining that with donation efforts, philanthropic entities that work through the county executive's office, we've been managing a donation side and philanthropic side that further supports our resource capabilities, as well as takes care of all those other things that aren't necessarily a priority to us initially. Our priorities were the necessary PPE, but the agency priority was first EMS, then police and fire, then hospitals, and then county government. And lastly, we had secondary health and long-term care facilities that we've been supporting as well. Nearly 600 agency distributions to date. We've narrowed down to 2 distribution days a week. That Rick Colella, many of you may know, is really our logistics chief and has been throughout and has been doing a fantastic job. And one of his greatest efforts to date is kicking off today. Rick and Keith Morris, our EMS coordinator, working with our other entities, the health department, the hospital association, have developed a decon station standard layout that we're working to acquire the material for right now as we speak. We're basically going to set up exterior EMS rig decon stations at 20 emergency room locations at 20 hospitals within Allegheny County, which will help facilitate when an EMS rig comes in, they do their patient transfer, they can immediately come out to a spot, do the proper decon of the entire rig and get back into service, which will eliminate, one, the hassle for them having to maintain that equipment. It standardizes how we're deconning. but it gets them back into service quickly. That's literally kicking off today as we speak, and I'll be happy to share that with everybody. Let's see. Again, I can't stress enough the benefit of Microsoft Teams. And at the end of this, as we've said from the start, as we all know as emergency managers, you have to plan for recovery, and we've been planning that every step of the way. The greatest benefit of Microsoft Teams is that we've got everything that we've been doing captured in one place. We're really excited for when the after action report time comes. We are very focused on our alternate care facility, making use of the Pittsburgh Convention Center. That is still in process, working out lease terms, but we're leaning very forward with our medical team and our emergency managers with the planning and preparations, as well as the logistics involved, the resources to stand that up when the switch gets flipped. And I believe that probably will happen within the next week or so. Initially, it'll be about 150 beds with the capability to expand into about 500. And the purpose is to allow hospital systems to take their less acute non-COVID-19 into that facility. It will not be open to the public. And we don't have a need for that within Allegheny County just yet, but this will be a regional capacity that will be able to manage that for the hospital systems within the region. Realizing, of course, everybody will be considered COVID-19 at some point, but concerted effort, at least at the beginning, to not put positives there. And that'll free up the hospital systems for more ICU space, et cetera. I think the keys just overall, just great teams, great partners, great partnerships. And the fact that all of us do that every day, I'm confident that all of you do as well. It's certainly a key part of the job that I always do, making sure we're communicating effectively, good trust and understanding of each other. And when I speak of this, I'm certainly giving kudos to our Region 13 partners, our City of Pittsburgh partners, our 400 plus public safety entities, PEMA, Phil and Director Padfield have been fantastic and great communicators with me with many of the issues we've had. We're all in the job of really having or making solutions and not creating problems. And, getting that good communication out there and getting everybody converted to that same thought just really helps. The use of the media has been fantastic. One of the very first media reports that I did with the county executive, we really enforced with county residents, I did, the need that at this point, every one of our residents is a first responder. Every one of them is an emergency manager. We all have a job and a task to do that will make this successful. And I can tell you, for the 1.3 million citizens of Allegheny County, they have been doing a fantastic job. They've all come up to the challenge. As many of us have all said, and I've heard it repeatedly, we're all in the business to adapt and overcome. Just continue to lead, but not fail. Don't burn bridges through this process. There's nothing personal about it. We've got to make tough decisions. We've got to make them relatively quick with good data to support them. Be positive and confident in the things that you do, and just keep up the great work. Anything I have that we're doing, I'm happy to share. Just reach out and I'll do my best to do that. Thank you.
Thank you so much, Matt. I appreciate your time. So I'm going to kick it over to Deputy Director Stevenson for some closing remarks.
Hey, folks. First off, thanks to Kirsten for putting this on. She did a great job of getting this organized and getting everything put together, and also gleaning through, the sit reps and the different information that's sent up from the county to sort of recognize and identify a lot of these best practices that were out there. And I really want to thank the folks that presented today. As we look through, what's being done out in the counties, there's just tremendous work being done out there from, areas like Sarah's up in the north central with very small rural counties that have just some unique issues that they're trying to deal with, to the bigger areas of the southwest or the northeast where, we have a lot more county involvement, the task force involvement, and those types of things. I think the key theme, that everyone, mentioned throughout, and Matt, you echoed it there at the end, is that, everything everyone's doing now is really predicated off of what they had done before, the relationships that were built, all those types of things. So although this is an exceptionally novel environment that we're operating in, and something that, every day is presenting some new challenges, the relationships that were built and the networks that were built before this are the things that will endure. Some of the plans, fell apart pretty quick. Some of the planning assumptions went away fairly fast, but the networks and the relationships are the things that will endure us through this. And I'm glad to see that was mentioned, throughout all the presenters. So I want to thank everyone for taking time. I know this is an important holiday for most everyone for a variety of reasons, and I really want to take a moment to thank everyone for participating with us today. And with that, I'm going to turn it back to Kirsten for a closeout and wrap up. Thank you.
All right, that concludes our WebEx. I sincerely apologize for the technological issues. That was all me. So thank you again for your time and your efforts, and we hope you all have a really happy Easter and Passover.
Thank you.